Good morning, colleagues, and welcome to another edition of the show VUKA Africa. And today I have another special guest with me. My guest in the house is Farhan Yusuf. He's a youth leader. He's based in Tanzania, and he's also a pharmacist. Farhan, you're welcome to today's edition of VUKA Africa. On today's edition, we're going to be discussing a very important topic, and that is the issue of malaria. Zero malaria, draw the line against malaria. That's the theme of our discussions today. And you might be wondering, why are you discussing malaria? We're discussing malaria because April 25 is oftentimes commemorated as World Malaria Day on an annual basis. We commemorate World Malaria Day on April 25. And in the lead up to that, we are going to be having discussions about malaria, the progress that has been made in the response to malaria, the challenges, and the gaps. Again, like I mentioned, I have a special guest who's going to be discussing the topic with me. And I'm sure that when you think about malaria, you think about your previous experiences with malaria. Mine were never pleasant. I hated the taste of the medicines. I hated having to take injections. I hated the fact that I needed to be off school or off work for a few days just because I had malaria. But anyway, back to our topic. How do we ensure that we reach the target as the world moves towards the deadline of 2030 to eliminate malaria, to ensure that we have zero malaria deaths in the world? What are we going to do differently? How do we address this issue? So, Farhan, I'm going to introduce you very quickly so that our audience knows who is Farhan. So, Farhan Yusuf is a pharmacist practicing as a health supply chain professional and a youth advocate in Tanzania. He has worked across the public, private, and NGO sector in the country with expertise in a range of areas, including health, logistics, and pharmaceutical supply chain, public private partnerships, monitoring and evaluation, communications, and knowledge management. So you can see clearly that Fehan has a wide range of experience on health related issues, but today we're zeroing on malaria. But, Fehan, welcome again to the show.
Thank you so much, Olaide, and thank you to the organizers for giving me this opportunity. Malaria is definitely something that I am very passionate about. I want to work towards eliminating malaria. So whatever I can do in that space is a great pleasure. So thank you for having me today. I look forward to a fruitful discussion.
Thanks, Fayhan. So let's jump right into questions for the day. I'm sure that our viewers are itching to learn more about, what progress has been made globally in Africa towards eliminating or ending malaria. Are there countries that have achieved or are approaching malaria elimination in Africa? What are they doing right? Because we hear that 94% of cases of malaria are in Africa. So, for the countries who have already approached malaria elimination, what are they doing right? What can we learn from them?
Thank you, Olaide. So I think globally, quite a bit of progress has been made towards malaria elimination. More than 100 countries globally have eliminated malaria in the past century. However, when we look at Africa, it's very interesting because we have about 7 countries, I guess, who we can say have managed to eliminate malaria. From that, we have Mauritius and Reunion that eliminated malaria way back in the 1970s. Then we have, Morocco that eliminated malaria in 2010. So those are, 11 years ago, and some of them in the 70s. What is interesting is countries like Lesotho, Seychelles, Libya, and Tunisia actually eliminated malaria in 2012. But it's interesting because when you look at the literature, it tells you that there malaria either didn't exist or just disappeared without any specific measures. So really, I think when it comes to Africa, the most recent case and probably the most prominent one of malaria elimination that we can actually consider is that of Algeria in the year 2019, where it managed to eliminate malaria along with Argentina. And I remember it was, quite a moment of celebration and of interest. Again, if you look at the literature and if you study the case of Algeria, we are told that Algeria was able to control and prevent sustained transmission of malaria through a robust integrated surveillance system. So you can see the importance of data monitoring, evaluation, and making informed decisions. A well-trained health workforce. So there's definitely a role that is played by qualified human resources for health, or HRH as we call it. Effective vector control. So doing something about, our pesky little buddies, the mosquitoes. Universal healthcare. So making sure that, all citizens in the country have access to the right kind of health facilities, and a rapid response to outbreaks of the disease. So whenever there's an outbreak, the health system needs to be agile enough to be able to deal with it there and then. Again, very interestingly, although Algeria finally eliminated malaria in the year 2019, it was actually the year 2013 where they reported their last indigenous case of malaria, which means for 6 years they were dealing with cases that were being, imported into the country. So quite a lot, I think, that we can learn from the case of Algeria.
Thank you so much for that very elaborate explanation, and also for taking us down memory lane and giving us feedback about countries who have already achieved this years before now, and those who have done that recently. And it's really interesting to hear about the success story of Algeria, and I'm sure that many countries would want to go and study what's going on in Algeria and the measures that they put in place to achieve the elimination. And you noted a very important point about the fact that for 6 years, what they were doing was trying to address cases of maybe malaria that was literally imported from other countries into the country. So it tells you that even as countries work towards eliminating malaria, there are challenges that they will face along the way. What are some of those challenges, that countries face as they work towards eliminating malaria?
Thank you for that, Olaide. So I think, earlier on, I also forgot to mention in terms of progress is that, if it wasn't for COVID-19, then today maybe we would be discussing a few more success stories, right? Because we had an initiative called E2020, Eliminate 2020, whereby 21 countries were slated to, end malaria by the year 2020, six of which were African countries. Algeria was one of them, and they managed to do it by 2019. But we also had countries like Eswatini, countries like South Africa, countries like Botswana that were also slated to eliminate malaria by the year 2020. So already we can see that one big challenge has been sort of that shift of focus from, malaria and other diseases to COVID-19 that has led to uh, a decrease of priority. When it comes to challenges that are facing, and I'll zoom in on our African countries, I think really it's almost the opposite of what is happening in Algeria that we need to consider, right? So first of all, one major challenge is poor access to healthcare. So the citizens in the country, how many health facilities do they have access to? How many health facilities are there? Where are they placed? And also, so even if you have health facilities, what kind of services are being provided? Are those services of good quality? Are they affordable? Especially in countries where maybe the public sector does not have enough health facilities and the private sector chips in. Are those costs that the normal citizen can afford? And what is being done to make that affordable and just have that environment of universal healthcare? Do we have enough, HRH? Do we have enough human resource for health in our health facilities? Is that human resource for health trained? Are they supported and equipped with the right kind of tools? Do we have sufficient supply chains of diagnostics, of medicines for treatment? Do we have, other means of support, such as, inpatient services and things like that? One thing that was noted in the case of Algeria, probably the first thing that was mentioned was, surveillance. Are we making informed decisions? Do we have systems that are capturing the right kind of data as far as malaria is concerned? Because, when we have limited resources, the best way to maximize output is to make informed decisions. But if we don't have the right kind of data or enough data, then making those informed decisions becomes very difficult. So do we have those surveillance systems? And lastly, I think one challenge that, I think we tend to mention it and then forget about it, although it has huge implications in the fight against malaria, is the issue of drug resistance. We all know that, at one point we were very comfortable with the kind of regimens that we have in dealing with malaria. Then resistance came in and we had to change. And now we are getting reports that even the current regimen are starting to face, resistance issues in many of the countries. So are we prepared for that? Are we doing the right kind of research? Are we ensuring that we have a pipeline of malaria, treatment medicine? So really, as you can see, there's quite a bit of work that we have to do.
Clearly, thank you so much, Frehan, for outlining the things that we need to do, and it's a lot, and so the question will be, what do countries prioritize first, given a whole lot of issues that need to be addressed? And that takes me also into our third point of discussion. You've outlined a lot, and we know that Algeria has done it. It's possible many other African countries can do it. So, what measures need to be taken towards achieving zero malaria? This is the year 2021. So, we have less than 10 years to go to achieve the goal of zero malaria by 2030. How do we draw the line against malaria? What do we need to be doing differently as civil society, as communities, as government, as stakeholders in the malaria partnership? What do we need to be doing differently?
Thank you so much, Olaid. And I think what I'll start off with, I see there's a comment here by one of the viewers that, ending malaria is possible. Algeria did it in 2019. More countries in Africa can do it. So I really think that's a starting point, right? Just that spirit that we can definitely do it. So thank you for that. And I look forward to hearing from other audience members as well. So that is a good starting point. And I think we are lucky that as we do have a lot of support. So for example, the Global Fund provides 56% of all international financing for malaria program. We do have initiatives such as the President's Malaria Initiative that's supported by the US government. We do have the African Leaders Malaria Alliance. So we have the Rollback Malaria Initiative. So we do have quite a bit of support as far as malaria is concerned. And a shout out to all of these different supporters. We urge you to keep that support. We urge you to keep that focus. However, I think I'll highlight maybe three important things that I feel, especially when we talk about in country and in country elements. Number one, I think, is although we have all this external support, right? I think domestic financing, domestic resource mobilization, domestic funding are extremely important so that we can have sustainable initiatives. Of course, we definitely have a challenge of competing priorities, especially in African countries where we are dealing with HIV/AIDS, we're dealing with TB, we're dealing with neglected tropical diseases. However, we have to try our best so that we can mobilize these funds internally and be able to use them effectively to make a change and to end malaria. One thing that can definitely help us, again, I'll emphasize on data. I'm very data focused, and I really believe in evidence-based decision making, especially when we have limited resources, right? So we need to know what is actually happening in our countries, what are the priority areas, because the way malaria works, even within a country, there might be very different sort of regional behaviors or regional prevalence of malaria. So are we targeting our initiatives? Are we targeting our resources in the right way? I think another thing that would definitely help, of course, when we talk about financing, then there are elements that the financing will support, such as having, the right health infrastructure, the right HRH, ensuring supply chain of diagnostics and commodities. These are all things that we need in the fight against malaria. They are our tools. But I think lastly, there definitely has to be a focus on community mobilization, and that is where our CSOs come in. That is where our, these different organizations that work with the communities come in, because that is key, right? You can have all of these tools, you can have all of these financing, but if the community is not responding to the solutions that you are asking for, it's going to become very difficult to draw that line, right? And also within community mobilization, I think it's key for us to engage the young people, the youth of Africa, and I'm glad to be a part of one such initiative, Youth Leaders for Health, that was aiming to promote youth advocacy as far as health, universal health coverage, and specifically ending malaria is concerned. And there's a very big importance to that, because youth know what is going on in their countries. They are in touch with the grassroots. They know the language, they know how to reach people, they know what works, what doesn't work. So really engaging youth and, pushing them to work at those grassroots levels will definitely bring a lot of change as far as drawing the line and ending malaria is concerned. I think sort of, just to uh, end this point of mine, in the Youth Leaders for Health initiative, we had a hashtag, which is the beat continues. And so I guess we must ensure that the beat on malaria and the beat on ending malaria definitely continues, even in these times of focusing on other challenges as well.
Thank you, Farhan, for that. I really like the fact that you ended with that, you know, no matter what, the beat continues on ending malaria, because so many people in our communities have been affected by malaria. And if Algeria could do it, we can do it as well. So we need to continue to encourage countries to step up and, you know, make accelerated progress to actually eliminate malaria in our lifetime. And I really look forward to having malaria eliminated in my lifetime. I'm sure we have questions for our guest on the show. I see a comment. Well said, Farhan. The youth of Africa must be engaged in malaria elimination. The youth are in touch with grassroots and not what works and what doesn't work. And I can say that the youth are also have been affected by malaria, so they also have experiences to share of family members and close associates who have had malaria. So we all have one story or another to tell. And I like the fact that you talked about the fact that, we really need to sensitize and engage our communities, particularly on addressing the issue of drug resistance. You find people who start their malaria treatment, once they feel better, they abandon it. And those are the issues that are causing drug related resistance for malaria in many of our communities. And we really need to sensitize our community members on those issues. Um, so, in the absence of any other questions from our viewers, I just want to wrap up with three key points that you raised. Number one, we really need to invest domestic resources to finance malaria programs, because if you don't have the resources to do that, then there's very little that we can do. We recognize and acknowledge the fact that the Global Fund has been supporting close to 56% of financing for malaria internationally, but our countries need to do more. They also need to invest their own resources in ensuring that we eliminate malaria by the deadline that has been set. Secondly, we realize that COVID-19 may have impacted on the malaria response, but we need to redouble our efforts and ensure that the the losses or the gaps that we have recalled, we are able to make progress and achieve progress on that. Number three, malaria elimination is possible. Algeria has done it, several other countries are in the lineup to doing it, and so we must also work together to ensure that. There's a question here for you, Farhan, before we leave. It says, what areas or what possible areas of synergy are there between ending malaria and addressing the COVID-19 pandemic? Do you see possible areas of synergy?
Yes, Olaide, thank you for that question, Andrew. And definitely, because I mean, if we think about it from a health system strengthening perspective, right? All of these are health related challenges. There are, diseases that are taking lives, and they need, preventative measures. They need community awareness. They need the right kind of diagnostics. They need the right kind of medication. So when you think about it, it's we're dealing with one disease, and we can definitely use that opportunity. We can actually use the momentum, because the one thing that COVID-19 has done for us, which I think can be taken as a silver lining, is that it's really brought health on the forefront. I think, back in the day, even as advocates, when we used to talk about health, it was a very interesting conversation to have, because there were other priorities just generally when economies are sort of thinking about economic growth. But now we know that if we do not take care of health, then the impact on the economy, the impact on, a normal life is huge. So in that way, COVID-19 has actually helped us bring health on the forefront. It's just that we need to keep on emphasizing that, yes, we are working towards, COVID-19 and, everything that's happening. But how can we sort of use that momentum, use those resources to also integrate other health challenges, such as malaria? I think one interesting thing that I've been reading about recently is that there are discussions around, if we could create a COVID vaccine so quickly. We've been talking about a malaria vaccine for a very long period of time, but so what's the challenge there? Can we use the same, speed that we did for COVID-19 for something like malaria as well? So I think it's really having that conversation about health, but then ensuring that, challenges, specific challenges such as malaria, are also brought to the forefront.
Yes, thank you very much. Like you rightly said, COVID 19 has unearthed the gaps in our health system, and it's just showing the various areas that we need to continue to focus on. Somebody made a comment saying that it's true evidence based decision making would prioritize malaria. 200,000 child deaths per year is just unacceptable. In fact, the number of malaria related deaths that we have in infants between the ages of 0 and 5 is totally unacceptable in Africa. And we really need to step up our response, in addressing all of these areas. Thank you so much again, Farhan, for throwing up a whole lot of very valid points and issues that we need to look at critically again. I'm hoping that we can continue this conversation on malaria, even beyond World Malaria Day. I think it's not right that we only focus on malaria just because it's World Malaria Day. Malaria is an everyday situation, a condition that a lot of people suffer from, and we really need to prioritize it. Again, thank you, Fehan, for being on the show with us today. Thank you for your insights. Thank you for the ideas you have shared. And we wish you all the best with the good work that you're doing in Tanzania, encouraging young people to ensure that the beat continues for malaria. Thank you, Fehan, and see you some
Thank you
other
so
time.
much. Thank you so much for having me, Asante.
All right, then, Asante. Okay, so there you have it.